Okay, we are rolling.
Everything good to go? All right.
Yep.
Sounds good. So Adam, thank you for being part of this today. As Kent County's health director, what are your biggest worries with this reopening of restaurants and bars next week? Because this has been a long time coming, and of course there are a lot of nervous people out there right now.
Yeah, so I'm very excited that we can reopen restaurants and bars along with other portions of the economy right now. It's going to be so important for the overall health and well-being of our region. I am, however, concerned, and I think all of us in public health are concerned because as we do that, we're going to add risk to this equation with COVID-19. Now, I think we can do that in a smart way, and I think people have learned the skills and the tools that they can use to keep this a lower risk activity and keep our numbers trending in a downward direction. But I'm concerned that people are going to think that we're somehow through this now, that we don't have to take the same precautions any longer and we can go back to life as it used to be. And that's worrisome because we can quickly see a resurgence in cases. And if that happens, we may have to go back to phase 3 in the startup plan. And that would be terrible for our community, both for the sake of restaurants and bars that would then have to shut down again, and also terrible because we would see more people sick unnecessarily. So very important that people follow through with the mask use and all the precautions that we've talked about.
So, from the local spin's perspective, what's been on hold for so long, and with a lot of musicians and fans of live music who are anxious to get back out there, for a concert goer who is heading to a venue for the first time, what should they be concerned about? What kind of precautions should they be taking in order to at least minimize the risk as they enter, let's say, a concert venue for the first time?
Yeah, so the larger concert venues, the inside entertainment venues are not going to be opened during this fourth phase of the My Start plan. As we get into the fifth phase and the sixth phase, as our numbers continue to trend downward, that's where we're going to start to see theaters and concert venues reopen. And it's going to be very important that we continue to be careful, we continue to be smart, we continue to create some proximity, some distancing between people. That's really what this virus is looking for, is creating new vulnerable hosts and jumping from one person to the next. So in as much as possible, even when our numbers decline, if we can make it difficult for that to happen and we can continue to keep the sanitation and the hygiene of these places at a high level, that's going to be very important for making sure that once they do open, they can stay open.
So that means wearing a mask. That means when you're waiting outside to go in, you should be maintaining a 6-foot distance.
Exactly. And if you're feeling sick for any reason, stay home. And I think that for so long, people have kind of dismissed the symptoms of a cold. Well, COVID-19 can manifest itself with those cold-like symptoms. And so it's important that one person's cold right now can be a life-threatening infection for another person. And so if you have fever, cough, difficulty breathing, or just the sudden symptoms of feeling sick, stay home and don't go out, don't go to the bar, don't go to the concert, don't go to work. We all need to be a little more cautious with how we treat just the basic signs of illness right now.
So, in the sense of the limitation, it is still, gatherings of, 100 or more, or if you can, 100 or more are not allowed?
Yeah, so there can now be gatherings of 100, up to 100 people in an outdoor setting. But they still need to maintain spacing and mask use in that sort of gathering.
How about indoors?
Indoors, it's at 50% of the building's capacity, and the building still needs to have a plan for how to space people at least 6 feet apart. That's still going to be an important thing in this next phase. And here's where we also want to encourage businesses to take advantage of the outdoor space in as much as possible as well. Trying to keep good ventilation is going to be important. But right now the cap is at 50% of capacity.
So let me take an example. You've got a bar that has a capacity of 120 limited to 70 people, but they also have to require spacing for people that are coming in to keep them essentially 6 feet apart. Is that right?
Correct.
So, if you're at a bar that's having live music, where frankly, even 70 people may have difficulty staying 6 feet apart, it seems to me like the capacity is probably going to be quite a bit less than that if they can't provide that kind of space.
Yeah, that's correct. It's going to be a bit of a challenge, and it might not be a great time for indoor music, and it really just isn't conducive to that sort of a venue right now. I think that you can do entertainment indoors in a bar or restaurant, but it's going to need to be pretty limited. And the people who are doing that are going to have to continue to maintain with facial coverings and the spacing requirements. So we're not to where we need to be yet in order to really open these things broadly. We're hoping that we get there very soon. Our numbers are continuing to trend downward, and we're hoping that if that happens, we can get to the next phase, which is going to allow for a lot more freedom for that sort of entertainment.
In essence, people should not be jumping the gun that this means we are now open for business. What it really means is that some places are open for certain kinds of business, but frankly, what we expected before all of this happened is not going to be the case come next week.
Yeah, we're still on thin ice. And the governor has made it clear, and she's brought up the Grand Rapids region a couple of times in her press conferences, noting that our numbers are still worrisome in the Grand Rapids region. And that's something that we acknowledge. And while I think there are reasons for that, I do respect the fact that right now our numbers, while we're trending downward, are still higher than most of the rest of the state here in West Michigan. And we could have a setback. And if all of a sudden we have people packed into bars and restaurants, that could quite easily precipitate that sort of setback and cause us to go back to phase 3, which would be catastrophic, and it would just be heartbreaking for the people who get sick, but also for restaurants that then have to close again. So we just want to be very careful right now and be as smart as possible so we can keep moving forward.
So as a musician who might be considering returning to the stage, and I know a lot of them are very wary about getting back out there, but some of them have indicated that they would be willing to try it in small places, in the sense of smaller settings, and outdoors potentially. So if you have an outdoor patio and you've got a guy with a guitar maybe in the corner or outdoor deck, what should a musician be doing to protect him or herself? You've got the problem with singing and the microphones and that kind of thing. And I know I work at a radio station, and we have to be very careful about putting covers on a microphone for each person that comes in for each shift. So what sort of things do you think maybe a musician should be careful about when if they're starting to consider going back and performing live?
Yeah, so I think it's really important that in as much as possible, we opt for those outdoor settings. Ventilation is going to be really key. And we have seen from so many case studies now that when we're indoors, the hotter outbreaks, along with the risk of more severe symptoms, often correlates with lots of people in an indoor setting. So getting outdoors is going to be a protective factor. Making sure that we're in a place that is spaced appropriately from other employees and from the patrons in that restaurant are going to be very important. And then making sure that the things that we're touching, whether it's the microphone or if it's other contact surfaces that other artists or other people have been in contact with, making sure those are properly disinfected on a regular basis is going to be important.
Yeah, I can see how that could be an issue too, because having been to hundreds and hundreds and hundreds of concerts over the last few years, the idea of sharing a microphone or being on a tight stage, like elbow to elbow with another player, is pretty common.
Yeah, and unfortunately, right now, the situation really doesn't support that. So, if it's if it's more than one musician, making sure that those musicians are spaced out appropriately, and that can be a challenge. And all that's going to count against that occupancy of that building. So, really having bands playing indoors has a lot of concerns in my mind, including the fact that if there's singing happening, we've seen multiple case studies where singing is a higher risk as well. And I don't think there's anything in the executive order that, that creates any kind of exemption from anyone who can wear a mask. Anyone who doesn't have some medical reason for not wearing a mask, that they should be wearing a mask. So I think the performers would need to be wearing masks, and that's not conducive to making music either. So, right now is really a difficult time to be thinking about indoor entertainment like that, and just to really encourage people to think more outdoors and think about it in the same way we're thinking about spacing and personal protective equipment and disinfection hygiene for every other way that we're carrying out our business right now.
Sounds to me as well that if you have a instrumental duo or just an instrumentalist or like a jazz trio that could space and play without having to sing, that makes more sense right now than a rock band, a 5-piece rock band helping it out on stage.
Yeah, absolutely. And I think there's a certain level of exertion and energy that goes along with a large rock band act like that, that also increases the rate of respiration. So now we're aerosolizing more virus and more moisture through breath. So that's not a great idea right now. And I think we also need to be very mindful of the executive orders. And there is some ambiguity in those orders, and it's not exactly clear what things are allowed and what things aren't. We're still doing some investigation, looking into things like campgrounds and other questions that we have that don't seem to be clearly answered by the executive order. And so I think it's very careful, and I want to make sure that any place of business is aware of this, to make sure that you really double check what's allowed and what's not allowed before you commit to anything, because you could be unwittingly walking into something that is in violation of the executive orders.
So, for bars that are opening next week, a lot of them are saying, we're going to open, obviously, to check things out or test things out, but we're not going to do live music for a while because we're just still trying to figure out how that's going to work. When they open the doors and start letting people in after all this time that they have not been doing that, what are the basics that they need to be doing in order to prevent the possibility of infection? I mean, we must be talking about regular sanitization. We must be talking about employees wearing masks.
Yeah, I mean, those are key. And we have to realize that we're not going to create a virus-free world. We're not going to get to zero risk, but we can do some common sense things to get to low risk. And I would strongly encourage, in fact, I would implore those places of business to go to KentCountyBackToWork.com. When they do that, they're going to find lots of guidance from us on how to make a low-risk workplace. They're also going to find information from us on how to get personal protective equipment for their staff, and also on how to get the employee health screening tool, so they can make sure that they are screening their employees when they come to work. So if they are ill, you can get them home and get them away from the rest of the workplace and the rest of the customers, so that we're preventing that exposure and that risk of further spread of the virus.
So one of the things that I've spent an awful lot of time over the last couple of months is essentially writing about cancellations of festivals and a lot of outdoor events that were planned for this summer. I mean, this upcoming weekend was supposed to be the Festival of Grand Rapids downtown, and of course they canceled, and they're going to be doing some live streams from home, that kind of thing. But there are still community concerts, and there are still some festivals in July and August that are talking about having people come and listen to concerts outdoors. Based on the current restrictions, though, if those don't change, you really can't have more than 100 people gathering outdoors to watch these shows, at least not right now, right?
That's right. Yeah, currently we're limited to 100 people in a gathering, and they still have to maintain spacing in a gathering of that size.
So the next phase would allow how much, do you know?
I don't offhand. No, the My Start plan doesn't provide those sort of guidances in the plan itself. It really depends on the discretion of the public health professionals in Lansing and the governor's office to determine what's appropriate at that phase.
So those who are planning, for instance, to start up in, let's say, early July, they may not be able to do so once this actually gets there unless some of those restrictions change. And right now, of course, no one knows when that might happen, right?
Yeah, unfortunately, that's the truth. And I think we all have to watch the epidemiology on this and see how the community responds to moving to phase 4. And hopefully our numbers continue to decline. And if that's the case, I hope that we quickly move to phase 5. But if they start to go the other direction, then we're going to have to rein things back in. And it's all part of the, that dance that we've talked about where, we've flattened the curve. And now we've got this long period of time between flattening the curve and having a vaccine available that we're going to have to do what we can to loosen restrictions, keeping an eye on the epidemiology and the hospital inpatient rates and other data to make sure we're not overwhelming the system while also allowing for as much freedom and as much economic development and activity as possible. So I really hope that we can get there as quickly as possible, but we need everyone to play a role in that and make it difficult for this virus to spread by wearing the mask, by respecting the social distancing and all the other things we've talked about that hopefully will continue to help us on this good path and get to phase 5 as quickly as possible.
I would think it sounds like just the idea here is be very cautious. I mean, your recommendation probably would be that most venues should not be jumping into live music yet, that you might want to wait because, and that if they do, that it really should be outside because that's where the transmission is less likely. But the bottom line is that, if people think this is over, they're wrong, right?
Yeah, unfortunately, we have a ways to go. And we've always kind of thought that we would see our numbers fall during the warmer weather because there's more ventilation, there's more sunlight, there's a little more humidity. There's a lot of reasons that make it difficult for a respiratory virus during those summer months. But fall's going to come, and winter's going to come, and we're probably not going to have a vaccine before that happens. And so we're likely to see resurgence. We're also likely to see clusters of outbreaks at places like a concert or a gathering where people didn't follow the public health advice. And we want to avoid those as much as possible. For the most part, most people get through this infection pretty well, but some, especially those with those underlying health conditions, really struggle. We have seen a lot of death. We've seen, I think, 89 or 90 deaths as of today. And we want to see as few of those as possible. And that just requires everyone doing their part to be as smart as possible. Living life and engaging with business in the community is really important. I mean, to do that, but I think we all can take these approaches, be as smart about it as possible so that we can keep the rate of infection low and get to that next phase as quickly as possible.
I carry hand sanitizer with me all the time, and I wear a mask, and I do those sorts of things. But of course, in the music business, hugs and chest bumps and high fives and the kinds of things that people have gotten used to doing over the years can't really happen right now, right?
Yeah, and it's a great example, John. I think that there's a lot of emotion and intensity and passion in the art of music. And right now we're in a place that it's terrible and it's unfortunate, but things like high fives and chest bumps and all that are really exactly what this virus is looking for, to spread person to person. So we need to scale that back for the near future.
And it sounds too, I just got an email this week from a vintage Carlo orchestra. They're like a 30-piece orchestra, which has had real trouble. They can't even practice together. Essentially, they've got as many as 10 people socially distanced in a garage that are playing at this point, and don't know how they can't really even practice right now. You got the Grand Rapids Symphony that's sort of in the same boat. It almost seems to me like with wind instruments, singers, that it may be quite some time before those kinds of larger ensembles can ever perform again.
Yeah, right now what we're seeing is we've had a number of case studies where choirs, the virus has quickly spread. And so early on we were really concerned about surfaces, and we were concerned about the hand-to-face contact. And we still are. We know that that's one effective way for the virus to get from person to person. But as we see and learn more, we're finding that it's really the inhalation of aerosolized virus. And the sort of aerosolized virus that comes from coughing, from breath, from singing, from sneezing, of course, but playing instruments where you're pushing air and pressure through a device, that contains moisture, and that moisture contains virus particles. And unfortunately, that's exactly what and how this virus spreads. So, right now, those sorts of activities are in a very difficult position just because of the way and the nature of this virus.
Yeah, I worry because, I see some people are very wary about this and they're being smart. And then I go out and I see people who say, and I've written about this too, where some of the comments have been, let me make the decision whether or not I'm taking a risk by going to a show. Let's get things started. And I hear those kinds of, comments, and it makes me worry that 95% of the people in one of those environments will be doing the right thing, and one or two people who get over enthusiastic and decide not to wear a mask will be there being over exuberant, and they're the ones that cause the problem.
Yeah, that's a worry that we have also, that our nation is really built on rugged individualism and individual rights, and those things are important and they're precious. But a virus doesn't care about that. A virus, is looking for opportunity to move from one vulnerable host to the next. And even when you're saying, well, I'll make my choice, you make yours, that's true, of course, and people can do that. But the reality is that even when you make a choice that is a higher risk choice, you may have the freedom to do that, but you're also going to be then at much higher risk for bringing that virus to others who didn't make that choice and who might be at a much higher risk of having severe outcomes. And so, this is truly one of those situations where we all have to be mindful of everyone else. We all have to stick together as much as possible and do what we can collectively as much as possible to lower the risk for everyone. And by doing that, we're going to make it much better for everyone in the long run, because we're going to not only protect the safety and the lives of others, but we're also going to move this path along as quickly as possible so that we get to phase 5 and phase 6, so that we can open up more things and enjoy more elements of life as normally as possible.
Adam, I appreciate you taking the time. This is very valuable advice. It is certainly, I think, the kind of protocols and the kind of, precautions I think that people need to be aware of, because I do know that people are kind of antsy to get going. I can see it in my neighborhood. I can see it in the park. I can see it on the beaches, that people are just, it's nice weather and there's things they are used to doing during this time period. And we're in kind of a new world right now. So I appreciate you taking the time, and thank you. And as we move forward, I may get in touch with you again and see what the next step might be.
Hey, thank you, John. It's a pleasure, and it's always appreciate the opportunity to talk to you and to the community about ways that we can move forward and what we can do to make this the place that we want it to be, and to make sure that we get everyone there together safely.
Thanks a lot, man. Appreciate it. And thanks, Steve, for pulling this all together.
Okay.
You bet, John. We'll talk soon.
Thanks, John.